Big changes coming to the Medicare Part D drug coverage for 2024. Better make sure that you have the right Medicare Advantage or right prescription drug plan for next year. This is important. Hi, I'm Chris Bryan, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see along in this video. My goal is simple. It is to help you make a wise and competent decision about all of your Medicare choices. If today is your birthday, then happy birthday to you. Don't just count your years, but make your years count. So again, before I go into the Part D for 2024, I mentioned this in one of my previous videos. I just want to say thank you and give a shout out for all of you that have reached out to me that I have been able to help with your Medicare enrollments. Thank you for your confidence and trust in me. I greatly appreciate it. So let's talk about Part D drug coverage, whether it's standalone drug coverage or whether it's built into your Medicare Advantage plan for 2024. I did another video about a month or so ago that went into even greater detail. If you want to see that, check out this video up here. So this comes from the Medicare Trustees report. So the base premium is going to go from $32.74 to $34.70. Here's what you need to know about the base premium. It doesn't mean much to you. It's only there for Medicare to calculate the late enrollment penalty for Part D. Like if you delay your Part D, if you don't get it when you're first eligible, you're going to be penalized for it later. That's how they determine the penalty. 1% of that amount becomes your penalty based upon every month that you have been without it. Next, the deductibles are going to be going from $505 to $545 if you have one. Again, not every plan incorporates the deductible or incorporates it on all the medications, but that's what the base deductible is going to go from $505 to $545. The initial coverage limit will go from $4,660 to $5,030. And then the coverage gap, what we call the donut hole, is going to go from $5,030 to $8,000. That's the gap that you will be in. You will still pay 25% for your brand name and generics, but that will be gone in 2025. And then your catastrophic coverage is being raised from $7,400 to $8,000. I already alluded to it. Enter the Inflation Reduction Act of last year when it comes to your 2024 Part D drug coverage. Here are some of the highlights that are coming. First, more vaccines will be covered. There'll be lower costs for your insulins if you have them, lower out-of-pocket costs, so there'll be no 5% coinsurance in the catastrophic coverage stage anymore. And because of this, health plans will now be picking up that additional 5%. The question is, will this lead to increased premiums, co-payments, and more deductibles in the future? Then we have extra help, or LIS, that's called low income subsidy. That is a benefit from Social Security for people that are 135% or less in the federal poverty level. Well, good news, that's going up to 150%. So that means more people will qualify for this benefit. And what extra help does is two things. If you have a premium on your drug plan or part of your Medicare Advantage plan, it will lower it. And if you have expensive medications, especially, those will come down radically in price. So very beneficial for people that qualify for it. And then starting in 2025, the Part D out-of-pocket will be capped at $2,000. That is huge news. That's going to be big news for a lot of people that are on very expensive medications, because in the past, people were paying $5,000, $6,000, $10,000, $12,000, $13,000 a year when they had very expensive medications. Now there's going to be a cap of $2,000. Where they make that up from, I don't know. Only time will tell. So here's how it works if you want my help. Simply reach out to me by picking up the phone and giving me a call with the number that you see down below, or go to my website and fill out the contact page on there, and then I will reach out to you. I will send you an email with the electronic scope of appointment that you will need to review and check all the boxes. Click agree and submit. If that happens when you initially call me, then I can start reviewing options and benefits with you right away. If that happens after your initial call, and or you contact me through my website, then we have to wait 48 hours before I can review options and benefits with you. We will discuss and review your current coverage. What do you like? What don't you like? What would you change about your existing coverage if you could? I will need your medication list and names of providers to best help you. Once I have all that info, I will do a general review of the plans that are most suited for you. And once you pick the one you like or want the most, I will electronically send you the important plan documents, and we will especially review the summary benefits and plan star rating together over the phone. Then, if you want to enroll in the new plan, we will take care of the enrollment over the phone. You will be sent an email with a link to verify the enrollment. After that, you'll receive a welcome kit and a card, typically within 7 to 14 days, and your existing Part C or Part D plan will be automatically terminated. And I, of course, will be available down the road should you need any help with your plan or policy. So if you have questions, if you need help, you see my contact information, please reach out to me. You can also go to my website. There are a couple contact pages on there that you can fill out, and those will come to me, and I will reach out to you. If you could do me a favor, let me know what state that you are watching from. That does help me to determine what other states that I want to be licensed in as well. And if you happen to live within about an hour to an hour and a half of the Charlottesville, Virginia area, and you would like to meet in person at a safe and convenient location, please reach out to me and we can probably work that out. And lastly, I want to remind you to please like, subscribe, and who do you know that could benefit from this video, please share it with them. That is it for today. The big changes that are coming to the Medicare Part D drug coverage for 2024. Make sure you check your annual notice of change. Make sure you do your due diligence and review your coverage options for next year. Again, if you need my help, reach out to me. I'm Chris Bryan, the Medicare analyst. Make it a great day.